Sometimes the world is a lonely place. This is especially true for people on the autism spectrum. Though they are often misunderstood, they are just as capable as any other in terms of success. You may be surprised that there are many famous people that have been identified as autistic. According to the Applied Behavioral Analysis site, the list includes America's Got Talent singer Susan Boyle, comedy legend Dan Aykroyd, and Temple Grandin, professor at Colorado State University. Many have heard of autism spectrum disorder, or ASD. However, some may not know the different ranges of the spectrum, the causes and symptoms behind it, or the treatment methods to help reduce those symptoms. The National Institute of Mental Health, or NIMH, states that autism is a developmental disorder that affects communication and behavior. Signs appear in the first 2 years of life. Autism Speaks defines it as a spectrum disorder, meaning that the ways people with autism think, learn, and problem solve can range from highly skilled to severely challenged. People with ASD also have varying skills and strengths. The NIMH reports that they have above average intelligence, they can learn and remember things for long periods of time, and they can excel in math, science, or art. As of right now, there is no exact cause of autism. However, according to Autism Speaks, research suggests that ASD develops from genetic and environmental influences, such as advanced parental age and pregnancy or birth complications. The Center for Disease Control, or CDC, states these following symptoms: trouble understanding feelings, delayed speech and movement, getting upset over minor changes in their routine, obsessive interests, avoiding eye contact or physical contact, ignoring personal space boundaries, and repeating words or phrases over and over, also known as echolalia. Unfortunately, there is no permanent cure to ASD. However, there are many treatment options, such as medication, therapy, and early intervention. According to the NIMH, medications can help with symptoms like aggression, anxiety, attention issues, and irritability. Autism Speaks lists several therapies to choose from, including speech therapy, behavioral analysis therapy, and occupational therapy. Early diagnosis and intervention programs are more likely to have long-term positive effects on ASD patients. The National Institute of Child Health and Mental Development suggests these 4 programs: family training, speech and language therapy, physical therapy, and nutrition services. In conclusion, autism is all around us. The CDC reports that ASD affects 1 in 59 people in all ethnic and socioeconomic groups. We now know what ASD is, the possible causes behind it, and the various symptoms and treatment methods associated with it. You may know someone with autism. I do. My 1 in 59 is my twin brother, Alex. That's why it is important to me that I help people understand autism. So for him and others like him, the world isn't such a lonely place.